Your words define you. The words you use define you and the way that you're perceived. So the question is, have you chosen your words or have your words been chosen for you? Hi there, I'm Greg Venning. Welcome to the Questing Chiropractor podcast. And today we have Mark Postles with us once again, and we're going to be talking about words. We're going to be talking about whether you've been able to define your own words you use in your practice life based on your purpose, based on your clear vision for what you want to achieve, why you're doing what you're doing, or have your words been chosen for you? And realize that every word we use comes laden with baggage and meaning, and some of it useful and some of it isn't. So have you explored this in your practice? Because a lot of what you experience in your practice as a reality will be because of the words you use. So join us for this discussion. And while you're doing it, contemplate how you might shift and change the words you use in your practice. Welcome to the Questing Chiropractor podcast. We help you grow as visionary, vital, and capable chiropractors who are always on. We do things differently as we help to elegantly awaken your innate wisdom within. We help you create robust, predictable, and trustworthy practices that serve oceans of people and yet still have free time for yourselves and your families. We use neuroscience to deliver better business results so that you can get greater, deeper, and more effective impact in more ways. We are Questing Chiropractors, and this is our story. Welcome back to the Questing Chiropractor. I'm Greg Venning, and I'm here to lead you on an exploration with Mark Postles once again. Mark, so great to have you back.
Hey, it's great to be back.
And Mark and I were talking, and we wanted to bring to you guys a discussion and an exploration on the power of words and the words you choose, and whether you've actually chosen your words or they've been chosen for you. So I guess let's start with the big level here, Mark. Like, what are words and what power do they have?
Wow. Well, I mean, I guess the word is a representation of a reality. And we have a way of gathering words together. If we happen to have those faculties, and people who don't have those faculties, then we'll use words in terms of sign language and so forth. So it represents something, and maybe take it to that rudimentary form that a child, when it grows, when it's going through, say, forming some words, and we find this like within babies, as they get checked, the first 9 months, or probably the first 6 months, they're very compliant. They're like little blobs, and they don't give a lot of feedback uh, of the obvious. And it's not to say for a second that it's not giving that child is not giving out. It is. It's giving out a huge amount of communication, probably high level communication. And once it's learned words, because words start to slow us down in this context. But anyway, the point being is that we haven't yet formulated that. And you'll notice that children on the table at that age are very easy to work with, and, unless there's something really going on with them. So, and they will let you know. So at that point, though, then they start to realize, once they start to crawl, that they have abilities and skills that will not, it's not that cool for them to lie on their back and be adjusted, or lie on their tummy and be adjusted. So they want to be up and moving around. So then that becomes a period of time, for maybe the next 9 months or so, until they start to develop the ability to communicate, where they can be quite toey around this. They don't like to have their nappies changed. They don't like to be held on their back for any period of time, until such time as they're walking, and they can start to bring in this vocabulary of being able to say no, and express themselves, and that then eases their angst, and that becomes another milestone. So the point being is that we have communication. We cannot not have communication. Do communication, And then because of our cultural environment, we take on certain words. And those words then um, create our neurological resonance, and that allows us to then interact with our world. And there are limits to that, very huge limits to that, you know. Um, they, the ability to have multilingual is certainly an attribute, I think, for children, and particularly those that live in areas such as Europe where there's lots of different languages. And, you know, there's different parts of their brain that get lit up by certain languages, and there's better expression for certain phenomena. But the word is just a clumsy sort of way of communicating in one's model of the world. And it does not necessarily mean that's so for everybody. So as we go into culture then sets up some priorities around this and says, okay, we have certain words that mean certain things in certain languages, and you know, it's applicable to our environment. So, you know, like an Eskimo, I believe, has some 14 different words for snow. And that would be appropriate because they live in the snow and they need to have those distinctions. So, you know, those who live in the tropics may not even have the word for snow, or it's not their reality anyway. So that becomes a limitation of our worldview. So the words that we have or that we do have a resonance, and that resonance is based on the representation that word has, and that then affects us neurologically. That then affects our behaviours, and that in turn affects the results we have. So if we look at it from this position, within a chiropractic context, um, with the contrasting components that we operate our world in. Now, if we look at the physical universe, for example, um, there is a body of thought that says, well, look, there's no intelligence. Um, you know, we just have to rely on science, and science gives us our certainty, and, you know, in the context of healthcare, we just treat symptoms, and we've got to kill the disease. So we've got to keep the person comfortable. We've got to give them painkillers and kill the disease. So that becomes, you know, a limited worldview when you start to look um, at the other options, and so the behaviours of that would be, well, um, the subjective and the objective are separate. We've got to separate those, and this has been done in society over, you know, the last couple of thousand years. We've sort of put the physicians had the role over the objective, and the churches had the role over the subjective, and they are separate. We are separate parts, and so within that, then we start to separate as individuals as well, because you know the holism of and the presence of a child, like a newborn baby, and I'm sure you've experienced this, is like takes grown men's breath away when that new baby comes into the room. Um, you know, and gets carried into the room, and people are like, oh my God, you know, and so that's a cohesiveness. That's beyond words. It's beyond description. And it's like the essence of love. You know, we can't explain it. It just is. And so the the antithesis of that is individuation, where we have words for things that create um, um, difference. So going forward from that, then you know, we use reason to um, break down and to separate and to identify differences, which is our left brain function. So particularly our quadrant two part, which is the area that's there to keep us safe. And it's a hindbrain function. It wants to make sure that we're not, you know, that we're not going to be hurt, and that we can get enough food and shelter and so forth. So, you know, that the words that that part uses are going to be very different to the words that the right brain uses. And so the left brain is about being comfortable and being tolerated. You know, so it's about putting up with the uncomfortable, and being able to be comfortable within a certain circumstance. So it's not it's just like saying, well, let's just tolerate it. It could be worse. And let's make a person feel comfortable there. So that becomes like small c chiropractic, if you like. It's a limited viewpoint in terms of the choices that we will make from that. So, if we look at the word human being, it's got those two parts together. The human is the left brain, the being is the right. Right. So how can we be human? How can we take our being and allow our being to be? And this is what chiropractic does. It takes it out and says, okay, there is a resonance here. There's an energy that we are immersed in, and that was D.D. Palmer's first discovery, and expressed in his book in 1910 that the cause of disease is any variation of tone. And so the resonance that we're in the vibration that we're in, defines the energy of the body. And in the case of disease, it is a variation in that. So the optimal tone's not there. So when we're using language that's not appropriate, then we take those words and we, as we always do with words, we create matter from those words. In other words, words do matter because the words create matter. And so taking those words and being aware that we create substance, we create matter, we create circumstance and events by virtue of the words that we tell ourselves and the words that we engage in on a regular basis. So even on an occasional basis. So
Yeah.
I think, so it leads us into a discussion then on, well, how is our profession relative to its words, and how are other professions relative to their words? Because we know that to kill a profession, you just take away its characteristic language. So that's, and we have a lot of violations of that. And so, these are resonating within us that cause our quadrant 2 to feel comfortable because we've got a label on it. And it has ramifications through into that quadrant 3 part in the right brain that is a behavioral aspect of it. It's a doing part, and it may not be that useful. So that's where we start to look at violations there, I think, right?
Yeah, and I want to jump right into a very classic example of that, and that's the use of the term patient. And the term patient has very specific connotations within a medical mindset. And if we think of that as that abstracted left brain label putting on the system, it wants to put a label on something. So then like we perceive we know a thing when we put a label on it. And once we put a label on it, then we can kind of file it away and it's done because we know it. So when we put the label patient on a person, because really they're a person, not a patient, we've put the label of somebody who suffers, and our job is to then go and kill the suffering, or kill the disease, create comfort so that they no longer suffer, and then they're no longer a patient. That's kind of like our duty of care in that space.
Correct.
And when we view them as a person, we can view whatever they are presenting, whatever process is happening within their mind body, as the presenting thing, and it might be painful. And certainly we don't want people to suffer unnecessarily. We're not claiming that at all. But the world of comfort is a very small world. If we try to keep our children in comfort all the time, they would never grow. They'd never scrape a knee. They'd never play a rugby match. They would never kick a ball. They'd never ride a bike. And so without depriving people of their right to be able to make their own choice, we want to be able to open the world to them in that space as a person and allow them to embrace whatever they're going through and find their deeper meaning for it, rather than robbing them of that life-leading potential. I was camping this weekend and we were sitting around a fire, and the conversation went to, well, what about the gift of pain? And quite a few people around the fire kind of stuck up going, what do you mean the gift of pain? Like, what do you mean the gift of pain? And like a little classic example, a nice way that I explained it often is, if you are walking around in a dark room, or maybe you're walking around with your eyes closed and you stub your toe on a coffee table. You know, your little toe, and you really bend it. It's a big stinger. And the table didn't jump out at you. So the gift of that pain is causing you to open your eyes or turn the light on and to look at the lay of the land and to be more conscious. It's an invitation to consciousness in a really deep sense. And if we're robbing people of that or short-circuiting their cognition of that, then we're certainly robbing the person of a part of their expression of life.
Absolutely. Yeah, yeah, that distinction is so important for us as chiropractors, I think. So, yeah, if you go to the dictionary, like the Oxford Dictionary, right? I mean, obviously there's multiple dictionaries, but they have similar definitions, and that is patient is a person receiving medical treatment. And so, it's quite defined for a given profession, or a given viewpoint, which is medical treatment. So, as distinct from, as you made the point there, a person or collectively people, and if you go and look at the dictionary definition of that, it's like a human being regarded as an individual. And this is a very elegant definition. I would suggest is that this is the human being, and that is one. The human and the being, and it is individual. We are all individual. And so I think, if we see the person as needing medical treatment, as you say, it's a this for that, which, as the doctor, superior to the patient, the doctor makes the decisions for the patient. And in no way am I saying that this is not necessary. It all has its place.
Yes.
It can be argued whether it has its place in healthcare, but it certainly has its place in emergency care and disease care. So, where that is the position of the medical profession, and it's really important that we have that, and we're really good at it. The question is, does it fit within the chiropractic context? And obviously there's some lines of um, blurring here, which could be said to be, well, yes, it does. And there are layers to our care and our responsibilities as chiropractors. And I think, if anything, it would see an evolution from being a patient to being recognized as a person, where there's an equal relationship between two. And this is where we've spoken before about asking great questions, because that's where the person or the people can then start to look at their individuality as a human being, and be more volitional in the way that they do their life, or the behaviors that they do, or the thoughts that they have. So
And
if
this
we
that sorry, Mark, that this really comes through in the medical literature as well. Like there's a rich vein in the medical literature where they're talking about how the word patient is dehumanizing.
Yes.
Yeah.
Yep.
And it's interesting because it's taking away that human being part. You become an object, you become something to be manipulated without any volition. And it really does take us away from what should be evidence-based care, where we really look at what that actually means, and person-centered care, which are two of the highest ethical principles and duties that we have in whether if we're in the world of that healthcare space. So just be aware for the listeners that this isn't a chiropractic thing. This is a big point of conversation within the medical fraternity as well.
Yes, absolutely. And so the things that flow from that are issues such as diagnosis. So if we once again go back to the Oxford Dictionary, it's like the definition of diagnosis is the identification of the nature of an illness or other problem by examination of the symptoms. And I think that's really important here, that the diagnosis depends on symptoms and the examination of those things, to then say, well, this is the nature of the illness, or problem, and there's a name that's usually given to that as well. Um, the the chiropractic viewpoint on that, and this is what has been used from through antiquity. Well, chiropractic antiquity, which is a little over a century, um, that analysis is considered to be a more appropriate thing to describe this action that we go through. And the once again, the dictionary definition of analysis is a detailed examination of the elements or structure of something. And I think that's really elegant when it comes to what we do relative to and our intent relative to our care for people is that we want to do a detailed examination of the elements or structure of something because we know that structure affects function. So, that's that's quite a jump in terms of what we do, or what we think and say and what we do. There's a big difference between those two. We might also look at the way in which we attend to that. So treatment has been used before in this context. Is medical care given to a patient for an injury or illness? So in other words, treatment is something that is the purview of medicine. It has no place within the chiropractic context in terms of the intent of chiropractic. And so that's what we generally refer to chiropractic application as care. And so, the words for that would be the provision of what's necessary, according to the Oxford Dictionary, the provision of what's necessary for the health and the welfare and the maintenance and protection of someone or something. So, it's a far more open application there, which allows us then to consider the health, but also the wellness, maintenance, and protection of someone or something. So it's far bigger than treatment, which is a reductionistic viewpoint. So within that, then we could go to the things that we look at, which are the so-called symptoms. And so a physical or mental feature, which is regarded as indicating a condition of disease, as the classic definition through the Oxford, as compared with a very commonly used word in chiropractic, which is signs. And so a sign is an object, quality, or event whose presence or occurrence indicates the probable presence or occurrence of something else. So there are signs the body gives off, and we observe those signs. We don't have a judgment about them in terms of symptoms. And so symptoms being the physical or mental feature which is regarded as indicating a condition of disease. So you would have a big distinction there between going from that quadrant 2 part of definition, whether it's symptoms or signs, in terms of how you do it in the quadrant 3 part of delivery, as would each of these elements. So whether we go and manipulate a person, which once again the definition would be to examine or treat by feeling or moving it with the hand. So there's a crossover here between examination and treatment, whereas an adjustment, once again to the dictionary definition, is a small alteration or movement made to achieve a desired fit, appearance, or result. So adjustment, apart from maybe looking at the prefix and the suffix, and the essence of that word, which would be to bring alignment of the mind back to center, but that's without having even taking that into consideration as derivatives, we'd say, okay, well, an adjustment is much more specific than a manipulation.
Yeah.
And so if we look at maybe the element of where we work, our clinic is from the word clinic, which is an establishment or hospital department where outpatients are given medical treatment or advice, especially for of a specialist nature. So once again, that is not really fitting to what we do. And so we look at a practice, and a practice is, once again, by the definition, the carrying out or exercise of a profession. So, the words that we use to define where we go and what we do in this context are game changers. And then you look at maybe the people we're catering to. So in one branch, which has become sort of a very popular branch of chiropractic, being pediatrics, once again, go to the dictionary, you'll find that it's a branch of medicine dealing with children and their diseases. So bearing that in mind, it's really important for us to consider what is our clinical intent here. And so if we're adjusting children or a child, it's simply a young human being below the age of uh, puberty. So that that becomes a definition which is very much fits within the context of chiropractic because it's not dealing with their diseases per se. So and it's not someone else's lexicon, and that I think is a critical point from a political point of view. The pediatricians have every right to be disturbed by chiropractors calling themselves chiropractic pediatrics, with 2 years after college under their belt and you know assessing children for their diseases. So, there is obviously expertise within our profession in this context. And it is about seeing children and allowing children the benefit of chiropractic care. So I think, this is sort of brings up the conversations I started with in terms of um, our profession is defined by its language. All professions are, all cultures are. And, like, in our country in Australia, there's hundreds upon hundreds of Indigenous, languages and with their cultures. They're very, very different, and the tribes around the country are very, very different, in terms of the way they express their reality to each other. And there's overlaps, but there's also huge differences there. So, there's, a chair of linguistics that of endangered languages because one of the ways that the white settlers got to break down the Indigenous Aboriginals in Australia was to ban their language, and the government banned Aboriginal for a long period of time. It's been rescinded now, but this Professor Zuckerman at University of Adelaide said, "Well, without a language, you do not have cultural autonomy, you do not have intellectual sovereignty, and you do not have culture. You don't have a heritage." And I think this is really important for us to listen to in the context of chiropractic and our language of chiropractic, that we have this um, structure that's passed to us by virtue of the words that we use, the intent that we have and the application of that, the nurture that it gives us, and then of course allows us to strut our stuff and to do our thing. And when we're doing our thing in the delivery area, if we're operating on language which is not um, um, consistent with our original intent, we start to run into problems. There's an incongruence there. So I think that would be the take home message to this. Like really look at your language and clean it up because it is um, a very destructive element in many cases to the efforts that we have or do as chiros. So, you know, but I think just one more closing point on this is that there is the energy, and we go back to the child pre-language, that beyond words, the deepest level of communication, and this is to quote Thomas Merton, it says, it's not communication, it's communion. And it is beyond words. And when we discover our unity, as you said, this is our sweet spot. This is where, regardless of the language, there's an underlying unity that exists, and there's a heart of gold behind every person, no matter what culture, no matter what language, no matter which side of the healthcare spectrum they're sitting. Um, our job here is to discover the unity. It's to discover the unity within ourselves, and our unity within our community, and at the same time, have that tension that's created by um, love and compassion and acceptance and lack of tolerance for that which is destructive at the same time. So maybe just finish on that viewpoint that there's a huge paradox here, and it is immensely fun to play with and um, to maybe to quote um, the one of the greats from the past, Mandela, who just said, and I think, Greg, it's probably an appropriate one here to finish on for you, is that we're here to walk you home. And he saw that this was one of his um, callings, is that we are here, and I take this now as chiropractic, is to walk people home to their truth, home to their essence, and despite the differences that may exist.
Beautiful, Mark. Thank you so much. So with the power of questions and curiosity, and then the awareness and intention of how we're putting forth our thoughts and our feelings into these words and how they create matter, it really is a transformative process and a transformative way in which we can serve the world, and we can grow our practices, but we can also deepen our practices in so many different ways.
Mm.
Mark, thank you
Absolutely.
very much. That was a powerful, powerful process there today, and I really do appreciate your words here with us today.
Mhm. Thanks, Greg. It's a pleasure.
Thank you very much, everybody. This is the Quest in Chiropractor. Please do remember to go onto your podcast platform and do leave us a review up to 5 stars. If you're seeing this on video, please subscribe, and we'll see you next time.